A stroke is a serious and life-threatening medical emergency that occurs when the blood supply to a part of the brain is suddenly interrupted or severely reduced. This disruption can happen in a matter of seconds, and the consequences can be devastating. Without a steady flow of oxygen-rich blood, brain cells begin to die rapidly, leading to permanent damage if not treated immediately. Every minute counts, and the faster a person receives medical attention, the better their chances of survival and recovery. To better understand what happens during a stroke, imagine a house with a blocked water pipe. When a pipe is clogged, water can't reach certain rooms, causing damage and disruption. In the same way, when blood flow to the brain is blocked by a clot or a burst blood vessel, the affected area is deprived of essential nutrients and oxygen. This lack of blood flow causes brain cells to malfunction and die, sometimes within minutes. The effects can be widespread, impacting everything from movement and speech to memory and emotions. The aftermath of a stroke can be life-altering. Depending on which part of the brain is affected, a person may experience paralysis, difficulty speaking or understanding language, vision problems, or challenges with balance and coordination. Some people may require months or even years of rehabilitation to regain lost abilities, while others may face permanent disabilities. In the most severe cases, a stroke can be fatal, cutting lives short and leaving families devastated. It's important to remember that strokes do not discriminate. They can happen to anyone at any time, regardless of age, gender, or overall health. While certain risk factors like high blood pressure, diabetes, and smoking can increase the likelihood, even young and seemingly healthy individuals can be affected. This is why awareness and education are so vital. Knowing the risks and recognizing the warning signs can help protect you and your loved ones. Recognizing the signs of a stroke and seeking immediate medical attention is absolutely crucial. Common symptoms include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, sudden vision problems, dizziness, or a severe headache with no known cause. If you notice any of these signs in yourself or someone else, don't hesitate. Call emergency services right away. Quick action can mean the difference between a full recovery and a lifetime of disability. Timely intervention can make a world of difference in stroke recovery. Treatments are most effective when given as soon as possible after symptoms begin. Medical teams can use clot-busting drugs, advanced imaging, and specialized care to restore blood flow and minimize brain damage. Rehabilitation and support services can help survivors regain independence and improve their quality of life. The sooner help arrives, the greater the chance for a positive outcome. By learning about stroke, sharing this knowledge, and supporting one another, we can all play a part in reducing the impact of this devastating condition. Together, let's delve deeper into the world of stroke awareness, empower ourselves with the tools to recognize the warning signs, and take action to save lives, because every second truly matters. Recognizing the warning signs of a stroke is crucial. Every second matters, and your ability to spot the symptoms quickly can make a life-changing difference. When someone is having a stroke, brain cells begin to die within minutes, so acting fast is essential to minimize damage and improve the chances of recovery. Strokes often come on suddenly, without any warning, and knowing the symptoms can save precious time. The faster you recognize what's happening, the sooner you can get help. Common warning signs include a sudden onset of symptoms that may seem to appear out of nowhere. One of the most noticeable signs is sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. You might see a person's smile become uneven or notice that one arm drifts downward when both are raised. These physical changes can be subtle or dramatic, but they are always serious. Another key warning sign is confusion, trouble speaking, or difficulty understanding speech. The person may suddenly slur their words, speak incoherently, or seem unable to comprehend what others are saying. This can be frightening for both the individual and those around them, but it's important to stay calm and act quickly. Sudden trouble seeing in one or both eyes is also a warning sign. Vision may become blurry, double, or completely lost in one eye. If someone complains that their vision has changed without explanation, take it seriously. Dizziness, loss of balance or coordination, or trouble walking can also signal a stroke. The person may stumble, feel unsteady, or be unable to move as they normally would. These symptoms can be mistaken for other issues, but when combined with the other signs, they point to a medical emergency. If you or someone around you experiences any of these symptoms, don't wait or try to figure it out on your own. Time lost is brain lost. Immediate action can mean the difference between a full recovery and lasting disability. Call 911 or your local emergency number immediately. Paramedics are trained to provide life-saving care on the way to the hospital. Remember, your quick response could save a life, maybe even your own. The good news is that many strokes are preventable. While it can feel overwhelming to think about all the things that can affect our health, the truth is that small, consistent changes can have a huge impact over time. By taking charge of our daily habits, we can empower ourselves to live longer, healthier lives and reduce our risk of stroke and other serious health problems. By adopting healthy lifestyle habits, we can significantly reduce our risk. It's not about making drastic changes overnight, but about building a routine that supports your well-being. Whether you're just starting out or looking to improve your current habits, every positive step counts. Surrounding yourself with supportive friends and family can make these changes easier and more enjoyable. Here are some key steps you can take to protect your health and lower your risk of stroke. Remember, prevention is always better than cure, and the choices you make today can shape your future. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean protein. Try to fill half your plate with colorful produce at every meal, and choose whole foods over processed options whenever possible. Incorporating a variety of foods ensures you get the nutrients your body needs to function at its best. Planning meals ahead of time and cooking at home can also help you make healthier choices. Limit salt, saturated and trans fats, and added sugars. Too much salt can raise your blood pressure, while unhealthy fats and sugars can increase your risk of heart disease and stroke. Read nutrition labels carefully and try to prepare meals using fresh ingredients. Experiment with herbs and spices to add flavor without extra salt or fat. Stay active. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be brisk walking, cycling, swimming, or even dancing. Physical activity helps keep your heart and blood vessels healthy, lowers blood pressure, and can boost your mood. If you're new to exercise, start slow and gradually increase your activity level. Find activities you enjoy so you'll be more likely to stick with them. Maintain a healthy weight. Losing even a small amount of weight can make a big difference. Carrying extra weight, especially around your waist, increases your risk of high blood pressure, diabetes, and stroke. Set realistic goals and celebrate your progress along the way. Remember, it's not about perfection, but about making healthier choices most of the time. Don't smoke. Smoking damages blood vessels and increases your risk of stroke. If you smoke, quitting is one of the best things you can do for your health. There are many resources and support groups available to help you quit, and it's never too late to stop. Even if you've tried before, keep trying. Every attempt brings you closer to success. And manage your blood pressure, since high blood pressure is a major risk factor for stroke. Regular checkups can help you keep track of your numbers, and your healthcare provider can offer guidance on how to keep your blood pressure in a healthy range. Simple steps like reducing stress, eating well, staying active, and taking prescribed medications can all help. By making these changes, you're not just preventing stroke, you're investing in a healthier, more vibrant future for yourself and your loved ones. Remembering the FAST acronym can help you quickly identify the signs of a stroke. F stands for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask the person to raise both arms. Does one arm drift downward? S stands for speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? T is for time. If you observe any of these signs, time is critical. Call 911 immediately. When it comes to stroke, every second counts. The faster a stroke victim receives medical attention, the better their chances of survival and recovery. Delays in treatment can result in greater brain damage and increased risk of long-term disabilities. Remember, acting quickly can be the difference between life and death, or, a full recovery and a lifetime of challenges. Stroke awareness is everyone's responsibility. By sharing this vital information with our loved ones, friends, and communities, we can help save lives. Talk to your family and friends about stroke symptoms and the importance of acting fast. Encourage them to learn the FAST acronym and to call 911 immediately if they suspect a stroke. Together, we can make a difference. It's not enough to simply be aware of stroke. We must also empower ourselves and others to take action. Encourage regular health checkups, including blood pressure monitoring. Promote healthy lifestyle choices within our families and communities. By working together, we can create a world where stroke is less prevalent and its impact is minimized.